So without further ado, Georgia, I really want to talk about the organization now. So Whole Washington, what is exactly the mission?
Well, we're a grassroots organization full of scrappy people, just normal people who really want universal health care. And we work on state-based legislation, and we support national Medicare for all. We hosted more than 10 barnstorms for Medicare for all right before they had their first historic hearings. We've done like car caravans for Medicare for all, but primarily, we work through the initiative process here in Washington State, attempting to get universal health care on the ballot. We ran an initiative in 2018. We got over 100,000 signatures, a 100% volunteer effort. We had no paid staff, and we're really, really excited about how many signatures we got. But in Washington State, you need almost 300,000 signatures to qualify for the ballot. But a lot of initiatives do take two times to qualify. The first time, you're just kind of getting out there, letting everybody know what you're trying to do, doing volunteer recruitment. And a lot of the times, especially with initiatives that don't have a ton of money like ours, you get about 50,000 to 100,000 signatures. Then you come back 2 years later and succeed, get on the ballot, and win. I worked for 735, and that's what happened with Initiative 735, which was the initiative to overturn Citizens United the first time around. Not enough signatures. The second time, enough signatures, and we passed by 64%. So that's what we were geared up to do in 2020. We were going to do another initiative, and then COVID-19 hit. So we've been kind of refocusing on the legislative process. We had a bill the last session, SB 5222. That was our initiative just introduced into the legislature. And we had 3 sponsors for the last 2 years. The bill's going to be introduced, and we're going to have way more sponsors this time. So that's been really, really exciting. One of the things that keeps me very optimistic this year is that a lot of elected officials, candidates, politicians who have historically been really, really hesitant about supporting universal health care have come around, because it's clear that healthcare should not be tied to employment. COVID-19 demonstrates that better than anything ever has before, I think. So that's something that keeps me really optimistic. Also, there's another great organization that I work with called One Payer States, that a lot of different states are gearing up to run initiatives in the next couple years. And the great thing about that is I feel like historically a state like Colorado did it. California had a pharmaceutical bill, but in different years, and that allows like the insurance companies and the pharmaceutical companies to just really focus on defeating that one effort. So I feel like if we had a lot of states at the same time pushing for universal health care via ballot measure, we'd have a more likely chance of having at least one state succeed. And Canada passed single payer province by province, starting with Saskatchewan. Right. So that's kind of what our goal is to emulate that process. To that end, we just showed a great movie called Bitter Medicine that I would highly recommend to any single payer advocate who wants to see how Canada did get their system province by province. So
I'm writing it down. Bitter Medicine.
Mm-hmm.
All right.
And it's free online. So
even better.
Yeah, exactly. So yeah, it's really a great time to be focused on healthcare, with such a stark demonstration of why we need it.
So who were some of the initial sponsors? You mentioned you had 3 sponsors. Who were those initial sponsors?
So it was just a Senate bill. So the main sponsor was Senator Bob Hasagawa, a huge Bernie supporter. So no surprise there. And then Senator Karen Kaiser, and Senator Sam Hunt. But now we will have a bill in both the House and Senate this time. And some of the unique features of our bill versus any other bill that's ever been introduced is it's backed by a funding study done by Dr. Gerald Friedman, who did the funding studies for lots of other state plans and national Medicare for all. So he is an an amazing healthcare economist. It was also reviewed by our Washington State Department of Revenue and Employment Securities Department just to ensure that it was implementable. So if we're asking them to collect this revenue to pay for this new system, we need to make sure that they're able to actually do that. And so, and then also we have this awesome savings estimator on our website. You know, the biggest question you always hear, which sometimes gets a little irritating, is how are you going to pay for it? When we know every other country has this, every other developed country has this and pays a fraction of what we do and gets way better outcomes. So my general response is we already pay for it, we just don't get it.
Yes.
If somebody wants to know exactly the amount of savings that they'll have versus the system that we pay into now, which is a private for-profit tax essentially, versus this nonprofit gold standard plan that covers dental and vision and pharmaceuticals, they can actually go to our website and use this savings estimator built by the Progressive Coders Network for free. They did this for free for us. Using our funding mechanisms that Dr. Gerald Friedman and our initiative writing committee came up with, you can actually see, okay, this is how much I pay now, and this is how much I'm going to save with the new system.
That is awesome.
Even businesses can go see, you know, businesses are paying 15% and up of their payroll for insurance right now. So, and under the whole Washington Health Trust, it would only be 8.5%. So a business can go in and see how much they'll save per employee. So it's a really neat tool. And we've just done a lot of development on this bill and a lot of organizing. So I'm really excited for the future of whole Washington.
So I want to bring up kind of how, you know, this came to be. So I tweeted out about a week ago, honest prediction, we're less than 10 years away from universal health care, but it will happen one state at a time, kind of like cannabis. Now, I got some responses from some people that didn't like that tweet, which first of all, it wasn't a wish necessarily, it was a prediction. And they brought up that doing it federally would be better, which I agree. I just don't think it's going to go that way. And I think like we need to exhaust every avenue. So activism on the state level is still very, very important. And I think, would you agree with that, first of all?
Oh, yes. I much prefer Medicare for all passing. But in the meantime, like I said, we have hundreds of thousands of people in Washington State that we can help, or in other states that we can help, we can get coverage for. So why not work on both? I really don't understand why we argue continuously on the left about strategy. Let's just raise every effort up that we can. And, you know, it's not about who gets there first or whatever. It's about helping as many people as we can in the immediate future. So I totally agree with you.
Yeah. Because my thing is, it's like, look, and I know that a federal system would be infinitely better than any state system too. But as you've said, we're already, every state has people in it who are paying these ridiculous premiums. A state-run system would be infinitely better. You guys even have broken down the numbers specifically for your state, which is awesome. That's an insanely cool tool. So when other states see that, they're going to be, what the hell? Why don't we have that? And then eventually you'll get federal Medicare for all. And I think that, you know, and again, we can talk different strategies, but I really think that to get there quickest, that's likely how it's going to go. It's just a prediction. I could be wrong, but I just don't. I mean, when you have a president, an incoming president who vowed to veto it, when you have very minimal support in the Senate, I mean, it's basically Bernie standing on a deserted island by himself almost. And you still only have a handful of votes in the House, and you have, you know, a House actively working against it on both sides, Democrat and Republican. I mean, I feel like you got a much better shot going one state at a time.
Yeah, and that's kind of how I feel why I support the initiative process, because I get so disillusioned, asking, begging my elected representatives to do something to save so many people's lives. And then I go look at their PDC reports and they get a ton of money from for-profit insurance companies and pharmaceutical companies. And I'm like, are you ever going to do this? if you're getting tens of thousands of dollars from these different corporations. So I feel really, really lucky that Washington State is one of, like, I think it's 28 states that has the initiative process. So we can circumvent those elected officials who refuse to take action despite the fact that so many people are dying or going bankrupt, ending up homeless because of this ridiculous system we have here.
Is Inslee familiar with you guys? And what kind of response have you gotten or not gotten at all from him?
I'm sure he must be familiar, but he came up with his own plan called Cascade Care, and he was talking about how it's going to be the first public option ever implemented in the United States. And I've actually written an article about it because I was very curious. You know, a lot of politicians, they say something's one thing and it's totally not. And this is a perfect example of.
Of course it is.
So
I mean, as soon as you said the sentence, I rolled my freaking eyes at that. I'm like, oh god, it's going to be the first public option ever. You know what? Continue. Go on about the details. It's so frustrating because it's like, whenever you hear these politicians give this bullshit lip service, like, well, we can all coexist, and I mean, we got to keep the insurance companies at the table. It'd be like you're hiring an exterminator because you have termites in your house, and one exterminator goes, "I'm going to get rid of all the freaking termites," and one exterminator goes, "We're going to leave some of the termites, but we're gonna talk to them and compromise with them." Which exterminator are you going to freaking hire?
Exactly. Well, yeah, and the annoying part about it for me was it's so clearly not even a public option, and yet, like, CNN and all those cable news networks were like, "Woo, Inslee, first public option." And it's the HCA, the healthcare authority here in Washington State, contracting with for-profit insurers. So our money is further privatization, in my opinion. Our money, our taxpayer dollars, going to for-profit insurers, and only people who currently get their plans via the exchange would qualify. So that's not a huge percentage of Washingtonians. Most people are on Medicaid, Medicare, or get employer-based insurance. So only people who get their money, if they get their insurance through the exchange. And also, the only thing it does is it caps premiums at 10% of somebody's income. So if you make $50,000 a year, that still means that an insurance company can charge you $5,000 a year for a plan. And it doesn't do anything for copays and deductibles. So not only could they charge you $5,000 a year for the plan, but then they could say, oh, and you have a $10,000 deductible. So it was really frustrating for me the last few years, especially when, he ran for president and he was talking about his great public option. And because of that, a bunch of legislators also thought, oh, we're taking care of this. We passed this public option bill, so we don't need the whole Washington Health Trust. So that was a big challenge the last session. Getting a hearing or getting any movement on our bill was because everybody was talking about this public option plan, which really wasn't. So we had like a great opportunity to get a lieutenant governor who was very single payer friendly. Unfortunately, he didn't win his election. So now we have Denny Heck as our lieutenant governor, who was in Congress for decades and would just flat out refuse to co-sponsor Medicare for All. So,
what the heck?
Yeah, so we only have 2 Medicare for All co-sponsors here in Washington State, despite being super liberal, and neither of our senators co-sponsored the bill. So that's why, like, I really, again, appreciate the initiative process, because I feel like probably Inslee won't sign it into law, and certainly not if he gets appointed to the Biden administration and our lieutenant governor, Denny Heck, becomes governor. Denny Heck, I don't think, would ever sign a bill into law. But the great thing about an initiative is if we pass it, we don't need them to sign it into law. The people have the power in the state to make a law. So that's great.
how sad is it that I mean, when you saw people like Inslee and people like Steyer, and it's just the fact that there's anybody with a pulse excited about either one. It just shows how low the frickin' bar is. What did he bring to the table other than climate change? I'm willing to talk about it. I'm willing to say it. And I'm a governor. That's
Mhm.
me. And then Tom Steyer, like, I'm a billionaire. I'm supposed to be a piece of shit. And I am, but I'm a piece of shit who's giving lip service to climate change now. And I have a cute tie. And it's like, neither of you should be anywhere near a stage running for president. This is so unbelievable. The bar, it's not on the ground. It's under the fucking ground. It's
Mhm.
in the sewer. The bar is in the goddamn sewer. But I want you unpack this process, like unpack the initiative process. Like how exactly would it go start to finish?
So we have two different types of initiatives in Washington state, an initiative to the people and an initiative to the legislature. We're going to do the initiative to the legislature because we get like an extra 5 months for signature gathering. So what happens is we'll file in March 2021, hopefully, if things are better, we'll be able to collect signatures in 2021. So we'll file in March. We get the initiative language back to us and approved by the Attorney General. And then we print petitions and we start collecting signatures. And we have till January of 2022 to collect 300,000 signatures. Now, the legislature can either pass the bill as is at that point, because they'll be in session in January 2022. They can just put it on the next ballot, which would be November 2022, or they can put a competing initiative on the ballot, but they hardly ever do that. They only do that once in a while when somebody has a really bad initiative. So most likely what they'll do is they'll just put our initiative on the ballot, and then we have to get 50% plus one vote in order to win.
So basically, to get on the November 2022 ballot, which is likely where it would end up, you would need to get all the signatures intact by January of 2022. And then you would have that year. The big hurdle would be making sure you get the votes because, once you get on the ballot, there's also that reality of you are going to be facing $1 million campaigns trying to trick Washingtonians into voting against their own interests.
Yep. Yeah, that's why I'm really excited about the potential to run initiatives with a bunch of other groups. Not only because it's kind of like the insurance companies will have to play whack-a-mole with different states, but also because we can coordinate. We don't all have to reinvent the wheel. I think that if we have more than one state running an initiative at the same time, it'll be easier to get media attention. That's one of the things that's really frustrated me about the initiative process is, press release after press release goes out, and maybe one or two newspapers will pick something up. We'll be on a radio show here and there. But candidates, candidates get on radio shows, get interviewed on the TV all the time. That's one thing that's a real challenge, and I think that if we have a lot of states going at the same time, running initiatives at the same time, it'll be easier to get attention. So to that end, I also ran for office this year, so I could talk about whole Washington, because for the last 3 years,
What'd you run for?
State legislature.
Right on. How'd it go?
In a red district. So I'm very happy that I got over 20,000 votes, but I didn't win.
All right.
So, but that was impressive to me. I hadn't even lived here for a year at that point, and to get 20,000 votes, even though I'm pretty far left. But I've been joking with my friend Laura Fielding, who's the executive director of Red Berets for Medicare for All, about how frustrating it is that we can't get any attention for whole Washington, and maybe we should all just run for office. So actually 3 core members of whole Washington ran for office this last election. And I just used the opportunity every time I got an interview to be like, whole Washington, whole Washington, whole Washington.
That's awesome.
Yeah. So
well, alliances are where it's at. I mean, that's just, I mean, you need people, and electoralism is part of the alliance. It's not the whole thing. I think sometimes we tend to over amplify it, the collective we, but it's part of it, especially when you're trying to get something done at the local or state level.
Exactly.
So getting it back to healthcare, the other big thing about state initiatives, I think, is, I kind of look at it in parallel with, like, whenever you have an initiative you're fighting for. And one of the things that comes to my mind is net neutrality. And bear with me, here's the connection. But so when you have state net neutrality bills, obviously I want to see it come back completely. I want the FCC to reinstate it. But I also really see the value in state bills, because what you're doing, not only are you helping out people in that state, you're doing that, sure, but you're also helping out nationally, because once these states get net neutrality bills, all of a sudden you're whittling away at what these cable companies can get away with. Because if they want to roll out an anti-net neutrality package to price gouge people more, but they can't do it in New York, they can't do it in California, they can't do it in Washington State, well, then the numbers aren't looking so great for them all of a sudden. So, you start seeing, if there's a bill that gets through in Washington, a bill that gets through in California, although we've had a mess with our single payer bill here in California, and that's a big can of worms for another day, involving the single payer slayer Anthony Rendon. But all of a sudden, you're starting to really fight back against these insurance companies, and you're hitting them where it hurts in the pocketbook, and you're hitting them where it's like they can't get away with this BS anymore. And that's going to make it easier to get a national federal Medicare for all bill through, because all of a sudden you're just stripping their bottom line away. And you're forcing them to reinvent what they do anyway. And it's like, well, if you still want to exist, you're going to have to get into cosmetic or something. Otherwise, you're going away.
Yep. No, I agree. One of my favorite memes ever is that one where it shows like the date when every developed country got universal health care. And then the date it was repealed. And, it's never been repealed in any other country. So I feel like once one state gets it, and it's such a great demonstration of how much better the system is, then if you're an elected official in another state, voters are going to be like, if you don't give us that on a national level or on a state level, we're not going to vote for you. And it's the same thing, like in that movie Bitter Medicine that I was talking about earlier, they talk about how you cannot campaign as a candidate or a politician in Canada on the platform of repealing their Medicare for all system. Because if you do, you will not win. It's so popular there. So I feel like the same thing will happen if one state gets it here. People in other states are going to be like, well, look at Washington State. They have this gold standard plan. They're saving billions of dollars annually, literally billions of dollars annually. The state will save money because all the people who have insurance through the state, so the state, it solves some of the budget crisis that our politicians have been talking about. Businesses save money. Businesses will be like, hey, if we move to Washington State, we only have to pay 8.5% of our payroll.
Yes, we don't have to pay for insurance anymore. Yes. We're finally starting to see through the propaganda here in the United States. I mean, people are finally coming around to it. And a lot of single payer advocates, they've been ringing the bell for so long. I mean, you bring up Canada. You've probably seen the Michael Moore movie Sicko, right? Mm-hmm. So do you remember the part where he was talking to the guy from Canada who was talking about their system and saying, yeah, it works good. It's a great system. It's not perfect. No system is, but people don't go bankrupt because of medical bills here. That doesn't happen in Canada. That happens in the United States. It doesn't happen here. Mm-hmm. People get the care they need, and it's affordable, and everybody gets it. And, and Michael Moore goes, so you're probably like, you're really far left, right? And the guy just was confused as hell that he even said that. Like, it was just so out of it'd be like saying, hey, I like asparagus. Oh, you're a libertarian then. Like, it just made no sense. There's no connection there. Mm-hmm. And the guy goes, actually, I'm considered conservative here. And he goes, why Like he was confused. Like he's like, why did you say that? Like, what made you think? Because like over there, it's just not. And I know it's politicized to an effect. I know that there's right wing parties in Canada. They're trying to take funding away. I know that the Tories in England but they're not trying to take it away from people. Nor would they ever run on that because it's so, as you put it, insanely popular because it works.
Yeah, I mean, it would be like running on the platform of getting rid of the fire department.
Yeah.
I mean, people are just going to be like, what? No, this is great. When I go to the doctor, I don't have to worry about, oh gosh, is this out of network? Or how much is my deductible going to be? Or are they even going to cover this? That all of those questions will be a thing of the past, and every other state will want it. So that's how I feel about it.
Well, when you say you guys are cooperating with some other states, what are some of those states that you're, in regular communicado with?
Maine, I think, just announced that they're going to run in 2021. Massachusetts is also looking at running. I think they might do 2022, though. So every initiative process is a little bit different in different states. So they might run an initiative in 2022 and still be on the 2022 ballot. So like there are different rules in different states. And I know NNU is really gearing up to support that. Is it SB 562? Is that the number of your California bill? I think so.
Yes, I believe so. I believe it's SB 562. So California is one of the states.
Yeah, and there's a DSA organization in California that's been meeting to talk about running an initiative as well in California. I hope that a lot of other states hear what we're doing and follow suit, because my dream is to get 5 to 10 at least states running an initiative at the same time, because I feel like that would be really difficult for insurance companies to focus on 5 to 10 different states doing this all at once.
Yeah, you're giving them a big old headache. We're giving them a big old headache that we need to give them to fight back. And well, have you seen? I mean, since California came up, I mean, the very, very abbreviated version of what we've gone through and are going through. The nurses developed this bill, and some of the legislatures basically told them, oh, well, this, and this isn't in the bill, but don't worry about it. Just submit it as is. So they submitted it as is. And then Anthony Rendon was like, oh, this, and this isn't there. All the stuff we told you not to worry about, we're assholes. And then he shelved it because of that. And they were like, well, why? Let's fix this. Let's work this out then. And they were like, no, we just have to shelf it. Sorry, it'd be nice, but no, governor's not going to have to take the bad PR of vetoing this. We're just going to screw you over. And then if you protest this at any national conventions, we're literally going to tell you to shut the fuck up and get out, which is what they did to them at the Democratic convention when they booed Tom Perez. They told them to shut the fuck up, literally, and get out. So have you guys seen any of that deception at the state level in other places?
Oh yeah. So
okay.
The amount of excuses some people in the legislature come up with to not have hearings for the bills or let them out of committee, it's just amazing, the mental pretzels. But so both of our healthcare committees, the Senate and the House, are run by Democrats. Senator Annette Cleveland and Representative Eileen Cody. And they take a ton of money from for-profit insurance companies and pharmaceutical companies. And they've never let a single-payer bill out of committee. So they'll let it have a hearing maybe once every 10 years. But then it doesn't go anywhere. It dies in committee. And the excuses vary. Like, you cannot pass this because it requires federal waivers, which that's not true. We have a great transition plan that allows people to start opting into the whole Washington Health Trust before federal waivers are ever granted. Gosh, what are some of the other excuses? Oh, my favorite, like I was saying before, we can't afford it. We can't pay for it. And I'm like, we have 13 billionaires in Washington state who pay no income tax, zero income tax. why that it's clear we can pay for it. I mean, Jeff Bezos has said he's going to be the first trillionaire. And he doesn't pay any income tax in Washington State. It's so frustrating to me. But
and we're already paying it. We already pay these insane. I mean, Washington State is full of people paying these ridiculous premiums. It's like, oh, I pay $300 a month for my car. Hey, we're gonna do a better system. Your car payment's only $200 a month. How am I gonna afford a $200 a month car payment? Because you're currently paying. You just pay it to a different place. This isn't that complicated. And yet, if you pretend to not understand that basic notion, you can get a job on CNN.
I totally agree. It's so frustrating. So frustrating. But, and the other thing is like, because this is the excuse that Eileen Cody recently used when asked about the whole Washington Health Trust, is we don't have the money because COVID-19 budget shortcuts. Like, do you realize how many millions of dollars this will save the state of Washington? Because you will not be paying the high rates to private insurance companies to insure every school teacher or every state employee. It's going to save a ton of money. How do you not see that? But they do see it. I feel like they see it, but they just use those things as excuses to not pass the bills. Just like Anthony Rendon said, this bill is woefully incomplete because it doesn't have funding in California. Well, that's your job. Your job is to, if a bill is incomplete or needs fixing, that's your job as a legislator. Fix it. Fix it how it needs to be, pass it, and save people's lives.
And they told the nurses not to worry about it. They told the nurses not to worry about that because, as you said, that is their freaking job. Mm-hmm. And I mean, it's just, the deception is just, I mean, this is like grade school level pettiness. Mm-hmm. And we're supposed to just tolerate this from people whose job it is to serve the people. But they're just blatantly choosing like, no. We're going to lie to your face. We're going to stab you in the back at the behest of our big donor money from the insurance companies and big pharma. And we're going to do it right in your face. Mm-hmm. And then people like you and I, we're told we live in these progressive utopia, or as far as states are concerned, we're told we live in these progressive utopias. We don't, because there is no progressive utopia in the United States. I've lived in a handful of different places at this point, and I remain convinced there is not a progressive utopia in the United States. There's not even a progressive place in the United States, at least not governmentally. Mm-hmm.
Yeah, I mean, the closest I could think of is Vermont because you got Bernie Sanders there. But even then, the governor killed their universal health care bill because it was too expensive.
Yeah, well, and they ran a hell of a campaign scaring people away from it. Mm-hmm. And enough people, I mean, it worked. I mean, here in California, they just tricked a bunch of people into voting against their own interest and getting Prop 22 through. Which is that's the Uber bill for anyone who's not familiar, that allows apps to exploit workers indefinitely, and it's going to have a national effect. They ran a hell of a campaign to get a lot of people to vote against their own interests there, and that's what these organizations do. We had a drug bill here in California not too long ago. The pharmaceutical industry ran a hell of a campaign. It narrowly got defeated. So that's what we're up against. And that is also evidence that organizing like this is a very effective way to fight back. Because if it wasn't, they wouldn't, the powers that be wouldn't spend any money trying to squelch us. They wouldn't give a shit. They wouldn't spend millions of dollars on a campaign to try to squelch movements like this. If acting locally wasn't effective, Jeff Bezos wouldn't pump over $1 million into trying to get Sama Suwan off the city council. Now, I know $1 million for him is like a tissue for you and I, but still.
Yeah. I was extremely, extremely excited when that election went the way it did.
Me too.
I got to go to the victory party. It was awesome.
Oh, really?
Yes.
Well, it was exciting because at first we thought they were going to succeed, but then they ran the full numbers and it's like, nope, she ain't going anywhere.
Yeah, so Washington State is unique also in another way that we have mail-in ballots and have had for a while. So, and a lot of young people and more progressive people wait a long time to get those ballots turned in. So a lot of elections will flip in the last few days of counting ballots. So that was one of those elections that did, and it was so amusing because Egan O'Ryan had already declared victory and blah, blah, blah. And some of the papers in the Seattle area were like, oh, Seattle voters reject Shama Sawant. And then she ended up winning.
Mm-hmm.
Yes.
Yes. So where can people go to learn more about the organization and to get involved?
So wholewashington.org is our website, and we sell red berets on our website as well as Medicare for All masks.
Oh, cool.
Yeah,
That is
these
a
are
cool
awesome.
mask.
They're handmade by a volunteer. So you can just, like, they're right on wholewashington.org. You can use our savings estimator. And if you're in Washington State, I'd like to do a little call to action right now. Please contact your elected representatives about the Whole Washington Health Trust to see if they'll sponsor, and sign up to be a volunteer. We have, I think, over 300 volunteers who have already pledged to collect 200,000 signatures when we launch our campaign. I'd really like to see that number at 300,000. But that's something that's unique to our campaign. We've been organizing for about 3 years now to get our next initiative campaign launched. So having those pre-pledge signatures is a huge bonus for us, because we feel very confident that if we have 300,000 pre-pledge signatures, that we will be able to make the ballot and win.
Well, thank you so much for not only doing the show. Obviously, thank you so much for doing the show today, but even more importantly, thank you so much for everything you do. It is essential, and it is just so noble. I mean, it gives me. I have less faith in electoral politics than I ever had in my life, and I had very little to begin with. I mean, I think I was at about a 2%, and I'm now some negative number. I don't know what it is exactly, but it's in the negatives. But when I see direct action, and when I see people going towards cause-based initiatives like this, it really helps me keep up hope. It really does. So thank you so much for everything you do. Everyone, get involved. Go to wholewashington.org, especially if you're in Washington State. See how you can get involved on the ground floor. Georgia, thank you so much for doing this. One final quick question, though. Was it Bitter Medicine or Better Medicine, that movie?
Bitter.
Bitter, like, oh, that tastes bitter. Okay, gotcha. I just wanted to make sure. I'm sure I could have never figured that out on my own. I don't think the internet would have been helpful at all. I need to make sure I wrote it down right now. But thank you much for doing this. Everyone, go to wholewashington.org to learn more and to get involved. Georgia, thank you so much for what you do and your work.
Get your news on with Ron. Don't you want to know what's going on? We're getting our news on today. Get your news on with Ron. Don't you want to know what's going on? We're getting our news on today. You can tweet me an article at Ron Placone. We'll go through it together and make it our own. Get your news